Hi, my name is Megan Avery, and I plan on becoming an occupational therapist. For my motor learning final project, I will be presenting to you how a patient with only one leg will get out of a bathtub. First, we're going to start with diagnosing the learning situation. For my project, I will be filling in as my own patient. I am a 21-year-old female, and I have hypothetically lost my leg recently. Some of my patients' previous experiences include getting out of a stiff, straight-back chair and getting out of a low-sitting car with only one leg. While these experiences are similar to getting out of a bathtub, they are not as difficult because they do not require as much effort or energy. Since this skill does require the patient to get up from a lower angle of sitting and is new to her, she is in the cognitive stages of learning. However, since she has done this task previously prior to losing her leg, she does have somewhat of a basic memory of the basic movements involved. Given all of these things, I would say that my patient possesses average abilities. I believe that my patient will experience program learning, parameter learning, and generalization. The patient will need to develop consistency of the movements that are required and necessary to get out of a bathtub. Also, error detection and correction can be utilized for limb placement. The skill is a gross skill due to the use of larger muscle groups. It is also a closed and continuous skill. There is a presence of object manipulation because the patient has the option to use an assistance bar, which will be located on the side of the bathtub to help her stand. Information processing will also provide a large amount of feedback and play a role in determining how to place limbs and how high to lift them. There is a risk of injury due to water and floor type and other environmental factors. I would suggest that a no-slip bath mat be placed outside of the bathtub to ease this fear. This skill will take place in a home setting but will be taught in a clinic-like setting until the patient is comfortable and allowed to complete it on her own at home. At first, it will be taught in the presence of others, like an OT, and depending on the preference of the patient, can be performed at home in the presence of others, like a family member, once she is allowed to perform it outside of the clinic. Like mentioned earlier, one distraction could include the fear of falling and injuring oneself. Some other distractions could include motivation levels and embarrassment. Next, we have designing the learning experience. The biggest challenge will be only having one lower extremity to use as a source of power rather than two limbs, but I plan on designing a plan to help her overcome that challenge. My patient and I would set goals together. The overall outcome goal for this skill would be for my patient to be able to completely get out of the bathtub on her own by the end of therapy. One process goal would be for my patient to gain leg strength as well as muscles throughout each session that we have. Transfer learning would play a part due to the patient's ability to already get out of a chair and car on her own and would be able to be applied to this new task of getting out of a bathtub. I would suggest varied practice rather than constant practice for this skill due to the circumstances. Since my patient has only one limb now and she has been used to using both limbs up until this point, she may become easily frustrated if unsuccessful, and that will lower her motivation, which will make learning harder. Classifying expectations and clarifying them is extremely important. I will provide clear verbal instructions as well as visual demonstrations in order to help her achieve the ultimate goal of getting out of the bathtub. When practicing the skill, I will provide guidance for my patient as well as assistance as needed. Both intrinsic and extrinsic feedback are present. When it comes to types of feedback, I will primarily use verbal feedback, but will also be utilizing other types such as body language as well. I will also frequently provide summaries of each trial during our sessions. Next, we have modifications of learning situations. My patient's circumstances is unique because she is of age and has lived normally with both limbs up until this recently losing a limb. Now she only has one leg, which is a noticeable individual difference. The biggest modification will be the assistance bar, which will help her utilize her upper body strength instead of her lower extremity. I will also encourage her to stay positive throughout this whole endeavor in order to maintain high levels of motivation. Assessment of learner progress. I will assess her accordingly and to her accuracy and precision as well as how well they meet each part of the task. Now let's put this all into action. To begin, my patient would begin with her leg extended in front of her. Next, I would ask her to move her foot as close to her bottom as possible and place her hand on one side of the tub as well as the assistant bar. When ready, the patient would lean slightly backwards before pulling the upper body strength to pull herself forward with her hands while simultaneously pushing off the bottom of the tub with her foot in order to stand. I would have her practice this until she was able to do it on her own.
created using Powtoon.